Today I'm going to be discussing Kybella, a treatment for removing submental fat that I just don't think is worth it. And I'm going to explain why, and if you're thinking of having this treatment done, please make sure to watch this entire video because I think it could save you a lot of pain as well as money. Kybella is deoxycholic acid, which is really a byproduct of intestinal bacteria that aid in lipid destruction and lipid absorption. And it's not a new therapy. It's really an offshoot of a decades-old mesotherapy, where substances like deoxycholic acid were injected into the lower belly fat, where they would liquefy and get absorbed. In 2015, a company called Kythera got FDA approval for this deoxycholic acid to use in the submentum and reduce that fat. And it was marketed as the first and only injectable to reduce submental fat. So of course, everyone was very excited because it's a very difficult area to treat. And I, of course, signed up for training, and I was in the first group, which was going to be June of 2015. Well, June came, went, July came and went, August came and went, and in September, we found out that they sold the product to Allergan, the maker of Botox and Juvederm. And they sold it for over $1 billion. In an effort to recoup their investment, Allergan started a very strong campaign of remove the sin of the double chin. And they had a beautiful before and after picture. However, if you looked at it, it was the same photograph except digitally enhanced. That was the first letdown for me. I did take the training though, and I did start offering Kybella, and I was quickly let down by the results. And we're going to go into that now, exactly what I found to be shortcomings of this product. The first shortcoming was the cost. It cost a lot for me to buy it, and the average cost in New York ranged between $1,200 a session to $2,000 a session. The second shortcoming were the number of treatments required. Initially, it said one treatment would get you by and the patients would be satisfied. However, in reality, that wasn't the case. About 60% of the patients required 6 treatments. The third shortcoming was patient discomfort. After the injections, it was very uncomfortable. There was a lot of pain, there was a lot of burning, significant swelling. Some patients developed a gelatin feel to the submentum. You had to be very careful where you injected it as well. Even though we had a template that we would put under the submentum here and mark off where we would inject, patients still had some significant complications. Damage to the salivary glands, damage to nerves resulting in difficulty swallowing, difficulty speaking. Some people had damage to blood vessels, developing hematomas or loose blood under the skin. One of the worst things was with a superficial injection to develop necrosis of the skin, which means instead of the fat dissolving, the actual skin and subcutaneous tissue were dissolving, which led to open wounds that could become infected. So this was clearly not an injectable procedure that the patients were going to have and just walk away from. You needed at least 1 week of recovery from this. The fourth shortcoming for me was the unpredictable results. Once you injected the deoxycholic acid, you had no idea of the extent of lipolysis that was going to occur. The worst thing you could do with any type of lipolysis procedure would be to make a dent. So if by chance it killed more fat cells and liquefied more fat cells in one spot than another, you could develop a dimple or a dent that becomes very difficult to treat. So I didn't care for the fact that once injected, I had no idea what was going to happen. If anything, some people didn't get results at all. And finally, patient satisfaction. Remember, I said 60% of the people needed 6 treatments. So you're talking about quite an expense. And if you look at their data, 70% of the people were extremely satisfied after 6 treatments. That means 30% of the people were not satisfied. That's also reflected on Real Self. If you look at the actual satisfaction after the treatments, it's very low. One of the lowest for any of these cosmetic procedures. Therefore, I no longer offer Kybella in my practice. If somebody has a thick submentum, I send them to a board-certified plastic surgeon for a surgical liposuction. It's a one-time treatment And it actually has a shorter recovery phase, and to be honest, it could be cheaper than getting 6 treatments of Kybella. If you like this type of information and the anti-aging and rejuvenation videos, remember, click subscribe, hit the bell to be alerted to my future videos. Have a good day, and here's something I think you might enjoy.